As a practicing doctor, it's incredibly frustrating to me that insurance companies, most are for-profit entities. So patients are having higher premiums, they're paying into the system, and then they come in and they're incredibly frustrated that whatever they need is not covered. And they say, but I have insurance, and they don't get that the motivation of the insurance is to keep as much profit as possible. It isn't necessarily to pay for what you need.
Business people are running medicine, not doctors. A business person can get in the head of all healthcare providers making all these decisions, but also even convince, quite frankly, a doctor who probably went into the field of medicine for the right reasons, spent a better part of a decade training, but then dangle this, okay, you use this, we're gonna pay you an extra $10,000 the more you, and to the point where they literally do sham surgeries and ruin people's lives.
I was approached first when I started my practice about 10 years ago, 9 years ago. It was early on. I was approached by this gentleman saying that, okay, these are the screws. If everybody uses all these screws, we all make money. And the more you use, the more we make money. And with the other surgeons, if you guys all use it, minimum $10,000 a month to $40,000 a month, automatically just like that. And it's been shown that, you know, that some of the physicians who use this, all of a sudden the rate of surgery and fusion goes up. Now, greed, you know, can cloud your judgment.
30% of Medicare spending, it's estimated, goes to care that is unnecessary or harmful. And we live in a country where we talk all the time about we don't have enough money for healthcare. We spend more money on healthcare than any other developed country in the world, and we have some of the worst healthcare outcomes. And why?
Yes.
30% of Medicare spending is unnecessary or harmful, and yet no one's talking about this. No one's talking about this. Part of that Medicare spending went to this doctor who ruined people's lives. So I want to ask you this, in not just your field, but in general, I think it's actually at a point where the onus has to be a little bit more on patients, because I think we've been naive.
Educating the patients. I think one of the main things all the patients can look into is go where you're going to have surgery, talk to the nurses. The nurses have seen it all. You know, they have seen multiple spine surgeons, same procedure. They can talk to you about the outcome and give you their honest belief about what is going on. Get references. If you cannot get 3 references from that doctor, that's a problem. And the other thing is that ask the doctor, are you financially, you know, benefiting?
And I think if someone's also rushing you into a procedure that really should be elective, right?
Spine surgery, we're talking spine surgery here. Spine surgery is most of the time, thank God, it's elective. Unless your arm is so weak or your leg, you know that you're very weak and something bad can happen if you don't have surgery, but that's very rare. Most of the time you're having surgery because of pain, and pain is not emergency.
Mm-hmm.
And the good news, I will say, is we have some of the best spine surgeons in the world in this country,
That's
and they
right.
can do amazing things.
That's absolutely right.
Kudos to all those docs out there doing those things. But this
and doing it the right way.
Doing it the right way.
Ethically, doing it with the patients.
He offered non-surgical options first and left surgery as a last resort and gave options.
Most of the time. I've had some patients who've been told they need emergency surgery. They've seen me. Every other week I see a patient who's been told they need surgery next week, and most of those patients don't even need surgery. Now they're told they need emergency surgery, like they need to have surgery in a week.
Well, we're all learning as we go here. Dr. Melamed, thanks for being with us.
Thank you.